Good evening, everybody. Tonight we're going to talk about Chapter 14, which are neurocognitive disorders. Start the PowerPoint here. So when we're looking at the DSM-5 and how that has changed since the DSM-4, now disorders such as delirium, dementia, and amnestic and other cognitive disorders are now fall under that umbrella of neurocognitive disorders. So all of those other disorders are now under that umbrella of neurocognitive disorders. And this also includes dementia, and we'll be talking about Alzheimer's disorder a little bit further as we go through the chapter. So when we talk about severity of mental impairment, it is related to the damage in the brain, but there's also some other ways that we look at how the brain is damaged and the severity of the mental impairment. First of all, we can look at the nature, location, and extent of the neural damage. So how much damage was actually done, where is it located in the brain, and how is that going to cause or affect the person's day-to-day functioning. Next, we'll look at premorbid competence and personality of the individual. So where were their skill levels before this brain injury occurred or before the brain damage occurred? And then, of course, the individual's life situation. One thing that we are going to want to pay attention to is whether or not we look at diffuse versus focal damage. So when we're referring to diffuse, we're talking about widespread damage to the brain. So did it impact just one area of the brain, or did it impact a large or multiple areas of the brain? One way that we can see diffuse brain damage occur is during oxygen deprivation or through the ingestion of toxic substances. Other times, we talk about focal brain lesions, which involve just certain areas of the brain structure being changed. Sometimes we might see this through a traumatic injury. So think about Phineas Gage when that rod went through his eye and up through his brain. That would be an example of a traumatic injury. Or of course, a stroke can be another example of when we might see focal damage to the brain. This is a pretty good video that just talks about how our brain is plastic and how it can just change and mold and through different periods of our life. So I'd recommend watching that. This is just a nice little graphic that talks about how a stroke occurs, and it walks you through the steps. And here it just breaks down all of the different brain structures and the associated behaviors that we see if a person would be injured or if that part of the brain would be damaged. So there are different types of impairments that are associated with brain disorders. First one is going to be the impairment of memory. This is when the individual has trouble remembering recent events, although memory for past events may remain more intact. Some patients with memory problems may confabulate, that is, invent memories to fill in the gaps. Sometimes we have impairment of orientation. The individual may not know where he or she is, what the day is, or the time, or from who familiar people are. Number 3 is going to be impairment of learning, comprehension, and judgment. 4, impairment of emotional control and modulation. 5, apathy or emotional blunting. 6, impairment in the initiation of behavior. 7 is the impairment of controls over matter of propriety and ethical conduct. 8 is impairment of receptive and expressive communication. And 9 is going to be impaired visuospatial ability. I'll let you read through all of those when you go through the PowerPoint on your own instead of having me read all of those to you. So if we look at brain impairments of adults, when we look at neurocognitive or psychopathology interaction, most do not develop psychopathological symptoms, and many show minor deficits in cognitive processing and self-regulation. Psychopathological symptoms are not always predictable, and we can't always tell what's going to happen when the brain is damaged. A couple of slides back, it had a nice little slide that talked about the different areas of the brain, but although those areas control certain bodily functions or aspects of mental processing, still it can be very unpredictable how that person's going to respond if they have an injury in that area. Delirium is one of things that we're going to talk about. And this is a state of acute brain failure that lies between normal wakefulness and a stupor or a coma. Oftentimes, we're going to see somebody that's confused. They might have disturbed concentration and cognitive dysfunction. We also might see some impairments of memory and attention, and they might have hallucinations or delusions. It is treated as a distinct disorder, and it can fluctuate in severity. So it might be mild, it might be moderate, or it could be very severe. Oftentimes, we see those elderly and children at particularly high risk for developing delirium. And some of the causes are going to be drug intoxication or withdrawal, head injury, or infection. So concussions could technically probably fall under this, a head injury. Typically, when somebody suffers from a concussion, they might be confused, they struggle with concentration, they struggle with memory, attention, and we've also heard of people that suffer from hallucinations or delusions when they suffer a very severe trauma. Very severe concussion. And we also see high rates of suicide from somebody that has suffered from multiple concussions. Here, it just kind of shows you the continuum level of awareness. So there's that alert, awake, then we fall into that delirium category, stupor, and then coma. So how do we treat it? Well, it is a true medical emergency, and it often can be reversible, except when caused by terminal illness or severe brain trauma. It can be treated through medication, environmental manipulations, and family support. So in the case of, let's say, a concussion, limiting screen time, bright lights, giving the brain a lot of time to rest are all ways that we can help treat that. Next, we're going to move into major neurocognitive disorders. And the DSM-5 does use major neurocognitive disorders for the category of dementia. So oftentimes that is when our memory starts to fail us. We might start forgetting things more often, and there is a distinction between dementia and Alzheimer's, and we'll talk about that a little further as we go along. Dementia usually does involve marked deficits in cognitive abilities. So they might struggle with attention, executive ability, learning, memory, language, perception, and social cognition. I've watched multiple documentaries that have talked about Alzheimer's and early symptoms of dementia, and oftentimes they talk about being able to not being able to remember specific words. So it might be that tip of the tongue phenomenon. They might be trying to think of the word spoon, and they just can't grab it. They might say, that silver thing that's hard that you eat with. They might be able to describe it, but they can't quite find the word for that tool. Typically, we see a slow onset in older adults. So the older we get, the more likely we are to suffer from some of these deficits in cognitive abilities. And there are multiple causes, but degenerative brain disease is going to be the most common that we're going to see when we're talking about dementia. So what are some treatable causes of major neurological or neurocognitive disorders? Medications, especially when we're talking about some depression and anxiety medications, they can kind of have effects on your memory. I know a while back my mom was, I don't remember if it was for anxiety or what it was for, but her memory all of a sudden started to kind of slip. And I even had to have a serious conversation with my dad about it because my mom would repeat conversations 3 or 4 times, even though it was something we just talked about. And it was because of a medication that she was taking. Another one we can see is clinical depression. People that are depressed might have more neurocognitive disorders. They might have more problems with attention, remembering things, learning, all of those when they're suffering from depression. Vitamin B deficiency is another one that we can see that. Chronic alcoholism, of course, tumors or infections on the brain can cause neurocognitive types of disorders, blood clots, and then metabolical imbalances such as thyroid disease, kidney failure, liver disorders. All of those can affect our neurocognitive disorders. So when we're looking at the different causes, if we're looking at Alzheimer's disease, they say that about 56% of major neurocognitive disorders are caused by Alzheimer's disease. I want to go down to where we're talking about brain injury here at 4.4%. I'd be interested to see how that changes over time, especially as we're talking about more traumatic brain injuries, especially from athletes, maybe football players, and we're even seeing it from our military. They are coming back with traumatic brain injuries due to maybe a bomb going off. All of those types of things can cause that. So I'd be interested to see how brain injuries changes as time goes on and as we do more research into how sports and those types of things can impact our brain. Parkinson's disease is the second most common neurodegenerative disorder. It's characterized by motor symptoms such as resting tremors or rigid movements. One of the primary causes is the loss of dopamine in our brain. And the treatment that they have to try and minimize the symptoms or reduce them as much as possible are going to be medications and deep brain stimulation. About 25 to 40% eventually show some cognitive impairment. And Michael J. Fox is probably going to be one of the most famous people we know that suffers from Parkinson's disease. So what does that look like? What are some of the symptoms? Memory loss, dementia, anxiety, depression, hallucinations. They might have problems with facial expressions, drooling, difficulty swallowing. As we said, shaking and tremors are going to be some of the biggest symptoms that you might be able to see. And then problems with balance, walking, stoop posture, aches and pains are also symptoms of Parkinson's disease. Here's a nice little video about Michael J. Fox, just opening up about his experience with Parkinson's disease. Huntington's disease is another neurocognitive disorder. This is a rare degenerative disorder, and it can be found in about 1 in every 10,000 people. Patients usually develop dementia, and death occurs about 10 to 20 years post-symptom onset. So if you are identified as having Huntington's disease at the age of 30 to 40, which is kind of the common age range they see, they would look at death occurring between the ages of 10 to 50 if you were diagnosed with it at the age of 30 and start having symptoms. So it is typically a fatal disease, which is very sad and unfortunate, and there's not a cure for it at this point in time. Alzheimer's disease is one that is appearing more and more common in our society. It is a progressive and fatal neurodegenerative disorder. It's the most common cause of dementia, so that forgetfulness that people start to experience as they age. It is associated with characteristic dementia syndrome, and it is usually slow but progressively deteriorating course, terminating in delirium and death. So typically people with Alzheimer's disease, there can either be early onset or late onset, but it will result in delirium and death at some point in time. Clinical picture, if we're looking at it, most of the time the onset happens at the age of 45 or older, but even 45 is pretty young for somebody to start losing their memories, their cognition, all of those really important types of skills. In the early stages, it might involve just minor cognitive impairments, but at later stages, the dementia is more severe, there are more severe deficits. In those late stages, somebody might not even be able to recognize their own children, their husband, or understand where they're at, or even who they are at times. So it is a very severe and sad disease and disorder. Drugs can help with symptoms, but there is no cure for Alzheimer's at this point in time. So what is the prevalence? Estimated that the rate of Alzheimer's disease doubles about every 5 years after a person reaches the age of 40. So after the age of 40, your risk of developing Alzheimer's disease does increase pretty significantly. Today in the US, there are more than 5 million people living with Alzheimer's, and by 2030, an estimated 66 million people will be worldwide diagnosed with having Alzheimer's disease. There is a lot of research into it, trying to find out how we can prevent it, how we can treat it. There's a lot of money that goes into that, and it's a very important thing that we try and develop. Us poor females, once again, we have a slightly higher risk of developing Alzheimer's, and they're higher risks in North America and Western Europe. Here's just a video that talks about Alzheimer's disease. Some other really good videos out there is Dr. Oz. I'm sure you've heard of Dr. Oz. He's on NBC quite often. He used to be on the Oprah show. Sometimes he's on the nightly news. And his mother was diagnosed with Alzheimer's disease this past either summer or fall. And there's a lot of really good videos about how even him as a doctor missed all the signs and symptoms. Was it whether or not he just didn't want to see them, or he just missed them? He was maybe in some denial. But there's some really good videos out there, so I'd highly recommend going out and checking those out. So what are some of the risk factors? Here's a nice little summary. Advanced age, being a female. If you are a smoker, it will increase your risk of having Alzheimer's disease. Less years of education, having a lower income, lower occupational status, head trauma, obesity, and diabetes can all increase your risk for factors of Alzheimer's disease. Keeping your brain active, doing puzzles and reading are some of your best ways to try and ward off Alzheimer's disease as well. So what are some of the causal factors? Well, once again, there are some rare genetic mutations that appear to be the cause, especially with somebody who has early onset between the ages of 40s and 50s. Late onsets, genes can also play a role, but most cases occur in patients without family history. So although genes may play a role in this, many cases there isn't any family history of Alzheimer's disease. We're starting to look more at environmental factors and how maybe our environment can cause us to be at a higher risk for having Alzheimer's disease. Here it just lists the mutations that they have found to be linked to Alzheimer's disease. Neuropathology, some of our brain abnormalities are also being found to make a person at higher risk for Alzheimer's disease, such as plaques and tangles, and there's a really good video on here as well that helps explain what plaques and tangles are a little bit further. But when accumulation of the plaques, it can trigger inflammation, and inflammation has been found to cause a lot of problems throughout our whole body, not just our brain and Alzheimer's disease, but inflammation in our body is not good and has a lot of adverse effects on us. So here's just a nice little video that talks a little bit further about those tangles, plaques, and how that all affects the development of Alzheimer's disease. Treatment and outcome, as I previously stated, there is no treatment for Alzheimer's disease. They are working really hard to find one, but first they need to be able to identify what causes it and then how we can go in and treat it. Some things that help are behavioral techniques, antipsychotics, certain drugs that can help increase different areas of our brain, and drugs to decrease the impact of glutamate in our brain. Early detection is key. Once again, if we can detect something early, we can help start treating the symptoms early and maybe it won't progress as quickly. We also need to support caregivers. Taking care of somebody that is suffering from Alzheimer's disease can be quite the undertaking, especially as they get into more of those late stages where they might not be able to fully understand the situation. They might think they're back in their 20s. They might think they're in a completely different year. They don't remember their friends. They don't remember their family. It is a big undertaking for caregivers. Caregivers also feel like they become socially isolated and develop depression. There are other different types of disorders, such as vascular dementia, which is a series of circumscribed cerebral plaques cumulatively destroy neurons over expanding brain regions. It's often confused with Alzheimer's, but it is a different thing. It is similar in the fact that it affects people over the age of 50. It actually affects more men than women. So when we're looking at vascular dementia, men are affected more than women, but there can be some medical management to some extent compared to Alzheimer's disease. I'll let you guys just read through some of these. There are a couple of other neurocognitive disorders that can cause profound memory impact. But the one I want to talk about is TBI, which is also known as traumatic brain injury. It does affect about 2 million people annually in the United States. Falls and motor vehicle accidents are the most common causes. But we also see it when we're talking about assaults, sport injuries, especially those impact sports such as football. And as I previously noted earlier in this slide, we are seeing more and more veterans or people that served in our military coming back from war with traumatic brain injuries. Risk factors are going to be children between the ages of 0 to 4, especially because they, at that age, especially when babies are just learning how to walk, they often are kind of clumsy, they hit their head often. It's just kind of a natural progression. At one point in time, I asked my doctor, my daughter hit her head the other day. Should I be worried? And he said they're called bouncing babies for a reason, and that they have a little more protection regarding their brain and their head compared to older adults. So that was a little comforting, but seeing that risk factors between the ages of 0 and 4 is a little alarming. Adolescents between the ages of 15 to 19 are also at high risk, and adults ages 65 and older, especially because as people age, they tend to become a little more frail and are more likely to probably trip or fall and get injured and hit their head. Brain injuries are either closed head injury or penetrating head injury, and severe head injuries can lead to amnesia. When we're talking about retrograde amnesia, I know we've talked about this in the past. It is the inability to recall events immediately preceding the injury. So retro, think about past. But when we're talking about anterograde amnesia, also called post-traumatic amnesia, is the inability to store effectively in memory events that happened during variable periods of time after the trauma. So anterograde is going to be after the injury. Retrograde is going to be having difficulties remembering things before the injury. And concussions most definitely can cause TBI, and certain sports carry a higher risk. There is a really interesting video on PBS about the NFL and how they were covering up and responding to concussions causing brain injuries. I can't remember what it is called at this exact moment, but if you just look up PBS, football, and concussions, you'll be able to find it. It's about an hour long, but it is super interesting, and I do show it in some of my other courses, so I did not include any of those videos in this one. This is just kind of showing you what hippocampal volume looks like in college football players compared to controls, athletes without a concussion, and then athletes with a concussion. So what are some of the signs of a concussion? Well, temporary loss of consciousness, confusion or foggy feeling in the brain, maybe amnesia for the period surrounding the event, a headache that gets worse and doesn't go away, nausea, vomiting, excessive drowsiness, slurred or incoherent speech, difficulty remembering new information, and dizziness. These symptoms may not always be immediately apparent, and some might develop several days after the injury. I don't remember if I shared with this class or not, but I'm pretty sure my daughter had a concussion earlier this winter. I get a call from the nurse at her school, and they said that Briella isn't feeling very well, and she's coughing really hard and is throwing up a little bit, so I need to go and pick her up. So after I get there, I find out that she hit her head really hard on the playground earlier that day. She couldn't remember how it happened or what recess it was at. She had a really bad headache. She was really tired. She just wanted to sleep. She was throwing up, excessive drowsiness. Her speech didn't quite make sense. So I am almost positive that she was suffering from a small concussion, which is really scary, especially when she's only 6 years old. Here is just showing you how repeated head blows affect the brain. And a repeated head blow would be something that we often see happen among football players. Another video about that. Well, prompt medical treatment is going to be really important for somebody that is suffering from a head injury, especially if they need to remove the pressure from the brain. Sometimes they can develop epilepsy or seizures due to that brain injury. And the younger the child, the more adversely they're affected. They might have less language skills, fine motor skills, and struggle in other competency areas. I'll let you guys just read through this. It's just predictors of clinical outcome after a traumatic brain injury. And that is everything we have for chapter 14, neurocognitive disorders. If you have any questions, make sure you share them in the discussion posts I have listed. I will most definitely read those and get back to you on any questions you might have. I hope everybody has a good week, and if you need anything, please let me know. Thanks.